Good afternoon. You're through to the NHS 111 dental team. My name is Amir. Can I please take your name?
Oh, finally, I've been in absolute agony and I've been trying to get through all day. I can't eat, I can't sleep, I can't even think properly because I'm in so much pain. All I need is just some antibiotics right now.
Okay, I'm really sorry to hear that, sir, and I'm hoping I'll be able to help you on this call and help you out to get you pointed in the right direction. Can I just confirm, are you calling about the dental problem?
Yes, dental.
You are. Okay, perfect. And can I just take your name, please?
Yes, it's Jim Martin
Mm-hmm. And
and
your date
date
of
of
birth?
birth is 2nd of May 1991. I've been through this 3 times already today.
Sure, I completely understand your frustration, sir. I just want to make sure that we have all the right information so we don't lose you. Can I just also get a contact number in case we get cut off so I can call you back?
Isn't it on your screen already? It's 07324
Yep.
421.
Perfect. Thank you very much for confirming that. I just need a few more details. Can I please have your postcode and the first line of your address?
NW3
Mm-hmm.
5XZ. Listen, I've been through this so many times today.
Sure, I completely understand, sir. And I know it's pretty frustrating when you keep getting put through from person to person. But I just need to make sure that I have everything recorded to make sure I get you to the right place. So I do apologize, but it will it is necessary.
Okay, just hurry up.
Right. Can I get your first line of the address, please?
62 Chestwood Close.
62 Chestwood Close. Thank you very much. All right. And I'm assuming you're calling about yourself.
Yes, of course. Who else would I be
Okay.
calling about?
Well, sometimes people call about family members or partners, but you're calling about
Yes,
yourself, so
myself. I'm
that's
calling
fine.
about myself.
Okay, perfect. Thank you, sir. Right, so how can I help you today?
Like I said, I'm in complete agony. I've been in pain for the past couple of days, and all
Mm-hmm.
I need is just some antibiotics.
Okay. Can you tell me a little bit more about the pain?
It started 2 days ago. It's at the back of my bottom teeth. The
Okay.
gum there is all red. It looks really badly cut up back there. It's really tender to touch, and even when I
Mm-hmm.
swallow it, it completely just takes it out of me. It really
Mm.
hurts.
Okay.
This has happened before. I know exactly what it is. My dentist
Mm.
gave me antibiotics, and as soon as he gave it to me, it went away. Something to do with my wisdom teeth because it's, I don't know, growing all funny back there, and something
Mm.
about the other teeth blocking it. All I need is antibiotics. I just don't understand why it takes you so long just to give me some.
Well, we just need to make sure we're treating you safely and making sure that we're giving you the correct treatment. But we will, like I said, get you on the right path and figure out what's going on here. All right. So I'm going to circle back to that in just a second, but I want to ask you a few questions about your medical history, if that's okay.
Yeah, it should be on your screen. I've been through this.
We don't always have everyone's information on our screen, and because I'm actually a dentist you've come through to, so I'll be able to use your medical history to make sure that we're sending you down the right treatment pathway and making sure that we're prescribing the right things for you if required.
Fine, what do you want to know?
Sure. Do you have any medical conditions at all?
No, I have a blue inhaler, but I haven't had to use it in months.
Okay. So you used it a few months ago.
Well, I can't remember when I used it, but it was a few months ago.
Okay. Do you know why you used it?
Yeah, because of my asthma. It's an inhaler.
Okay. So you suffer from asthma, and the blue inhaler, is it a salbutamol inhaler?
Listen, I don't know that. It's just know it's a blue inhaler. Haven't
Okay.
used it in months.
Okay. And do you have any allergies at all?
No.
Do you take any other medications?
No, nothing else. Just that inhaler, like I've told you already.
All right. And do you smoke at all?
No,
And any alcohol?
no.
Okay, perfect. Thank you very much for answering those questions, sir. So now I'm going to focus in on this pain you're experiencing at the back of your mouth. So which side did you say it was on again?
It's on the right side.
On the right side. Okay. And are you able to open your mouth wide, or are you limited in how much you can open it?
I haven't really tried because it just hurts so much to open wide.
Okay. Yeah, I'm really sorry to hear that. I know that these things can drive people nuts. So we're going to try and sort this out for you. Any swelling at all?
Yeah, yes. Well, when I look inside at the back of the mouth, there's a bit red there, so I guess it's a bit
Mm.
swollen. Listen, just all I need is antibiotics.
I completely understand, sir, but I have to go through these questions and make sure we get the right diagnosis because in some cases antibiotics might not be the answer. I know you've had success with it in the past, and if it is indicated, we'll definitely get you along the right path to get them prescribed, but I just need to make sure we're diagnosing the correct thing here.
Yeah, fine, go on.
Okay. So I'm really sorry to hear that it's so uncomfortable. So is when you look in the mirror, is one side of your face bigger than the other? Do you have a swollen cheek or jaw at all?
No, I don't think so. It's just
Okay.
red and swollen inside at the back of the gum on the bottom.
All right. Any breathing issues?
No. Why would
Any
I have
swallow?
breathing issues?
Sorry. Well, sometimes if the swelling expands, it can. But some patients can have trouble breathing. So do you find that when you breathe in and out, it's normal? You're not short
Yeah, I
of
can
breath or things
breathe.
like
I
that?
can breathe fine.
Okay, that's good. That's good to hear. And any swallowing problems at all?
Hurts when I swallow, like I said
It
before.
hurts. Okay. And any difficulty eating when it hurts when you swallow, or not too much?
Well, yeah, it does hurt because when I swallow, it hurts. It does.
Hmm.
Yeah, I don't understand what you mean by that.
Well, do you find that you're not able to swallow your food due to pain in your throat at all,
Yeah,
or
because
is
it
it
hurts when I
mainly?
swallow. So yeah,
Okay. So the pain is coming from the area where the tooth is, or your actual throat?
from that the back area on my
Hmm.
teeth.
The tooth. Okay, perfect. Do you have a temperature or fever at all?
No, I don't have a temperature. I don't have coronavirus. I don't know why you're asking these silly questions. It's my tooth and gum that's a problem back there.
I completely understand. It might seem a bit odd to ask these questions, but sometimes when we develop infections in the teeth, they can actually spread to other parts of our body and cause serious problems. So we just need to be sure that you're not developing any temperature or fever as a result of this tooth.
Yeah, that's fine. But listen, I don't know how many times I have to say this. Last
Hmm.
time I had this, my dentist gave me antibiotics and I was fine. So all you need to do is just give me some pills and I'll be out your way.
Sure. I completely understand, sir. But like I said before, we just need to make sure that we're diagnosing the correct thing and we're prescribing correctly. Because if I prescribe you antibiotics and it's not the right method to deal with this, then it's not going to do you any good. And I just want to make sure we're treating you properly.
So what are you gonna do then?
Well, first I'd like to ask: have you taken any painkillers at all?
I've taken a few paracetamols, but it's not really working. It helps for a little bit and then it
Hmm.
just comes back again.
Okay. And have you been taking them regularly, every 4 hours?
Sort of, but like you know, antibiotics is stronger than
Hmm.
paracetamol.
Well, I know that antibiotics can cause some relief, but they work in completely different ways. Antibiotics deal with bacteria, an infection, whereas the paracetamol and other painkillers will kind of dampen the pain and make things a bit more comfortable for you.
Right.
Have you tried ibuprofen at all?
Ibuprofen. Seriously, how do you not know this? I read online that you shouldn't take ibuprofen because of all this coronavirus stuff.
Hmm. Okay. Ibuprofen is actually completely safe to take. We've looked at the research and evidence on this. Um, and you don't seem to have any symptoms of the coronavirus so far. Ibuprofen actually works in a different way to paracetamol, and sometimes you can combine them, and they can be a really effective way to manage your pain.
And what about the antibiotics? Aren't they going to be better?
I think, considering what you've told me so far, that you don't have a swelling, you don't have any breathing difficulties, and also you don't have a fever or temperature, the antibiotics would probably do more harm than good in the long run for you. And I know that you had success with antibiotics in the past, but antibiotics don't actually cure toothache. We only give antibiotics when there's an actual sign of an infection that's spreading. And like I said, this would be indicated by swelling, temperature, fever, etc. And I wouldn't want to put you at risk of developing something called antibiotic resistance. And what happens is if we take antibiotics unnecessarily, bacteria. I mean, there's a whole lot of Darwinism and survival of the fittest, but the long story short, the bacteria that are resistant to the antibiotic will thrive, and then in the future, if you try and take antibiotics to treat an infection, they won't work, and you could become seriously unwell, and it could lead to a lot of other complications.
So why then did my dentist give me them last time?
I can't speak for your dentist at the time because I wasn't there during that episode of treatment. I don't know what your symptoms were or what the dentist was seeing. But if they made a clinical decision to give you antibiotics and it worked for you, then it was likely the correct call. In that case, all I can do is go on the details you're giving me today, and I don't think antibiotics are the right answer here. I
So
think what
what?
you've done. Well, sorry, please go ahead, sir.
I was just going to say, what are you trying to say? That I just have to live with it?
No, this is something that should settle down. I think from the symptoms you've described, you said there's a red fleshy bit in the area that's quite swollen and causing pain.
Yeah.
So that's actually the gum tissue that sits on top of your wisdom tooth. So it's called the pericoronium, and when it becomes irritated, you develop an itis or pericoronitis in this case, and that's basically when you develop an infection in the gums and around your wisdom tooth. Sometimes it can be because food gets stuck there. Sometimes it's because the upper wisdom tooth bites down and chews on it and irritates it. And it's due to the fact that there isn't enough space for your wisdom tooth to come out.
Yeah, okay, that's all good, but I don't understand what you're trying to say. What do I have to do now? Do I just live with it? Do I just wait for it to go away? What are you trying to say?
Well, so I think the first stage is we need to manage your pain because I think that's the real problem here. And as I said, I think the best course of action here is combining ibuprofen and paracetamol and alternating between the two. So I'd probably recommend taking 1 gram of paracetamol tablets 4 times a day. So that's two 500 milligram tablets, and then two 200 milligram tablets of ibuprofen 4 times a day. So that's 400 milligrams of ibuprofen 4 times a day. And the best way to do this is take the paracetamol first, wait a couple of hours, and then take the ibuprofen, and repeat that process. Repeat that 4 times. So that should cover you with a painkiller every 2 to 4 hours, and hopefully it should
Right.
manage your symptoms. And we just need to make sure we keep a tally and make sure that you're not taking too many or too few.
Okay, is that really going to help though?
I think that's the most appropriate treatment to undergo for now, and we can see how that helps and then go forward from there. But I think this should hopefully manage your pain. I've actually suffered from pericoronitis myself, so I believe you when you tell me how painful and irritating it is. And honestly,
Did you have
this method worked for me.
antibiotics?
I didn't actually have antibiotics during my episode because I didn't develop a fever. I just took painkillers, and it's something that resolves after 1 to 2 weeks normally.
Right. Okay.
One bit of advice I'd give you though is make sure that you take the painkillers after you've eaten, because taking it on an empty stomach isn't a good idea.
Yeah, but I can't really eat much because of the pain.
Okay,
So it's all
you
well
might
and
want
good
to
telling me that.
try a soft diet or a liquid diet for a short time until you're able to chew food again properly.
Right. Okay.
Okay, I can give you a few more tips if you'd like.
Well, it depends if those tips are going to help.
They should help normally. Again, this helped for me because I had the exact same condition as you.
Right. Go on then.
So what I'd recommend is, as well as taking the painkillers, make sure you rinse your mouth out with warm, salty water, especially after you eat, because this just makes sure you don't get any more food trapped in the area if there's something there already.
Okay.
And the other thing I'd recommend is using a small-headed toothbrush to just keep the area clean if you can. I know it's painful, but again, it just means you'll be able to clear debris from the area.
I think I've actually seen those toothbrushes before. My dentist did tell me to get one, but
Yeah,
never bothered to be honest.
yeah,
Don't
no,
really
they're
think they
really
work that
useful.
well.
You can get them in the supermarket or chemist. They're quite good. Um, and I'd try that. See if this helps you over the next 2 to 3 days. If it doesn't, or if you develop any kind of swelling, any difficulty breathing, any fever, please do give us a call back and we'll see if we can get you seen by someone. But for now, I think hopefully these bits of advice should maintain the issue. Sorry, I shouldn't say maintain, should manage the issue.
Right. Okay, well, I just hope you're right because this pain is making me completely miserable. I can't concentrate on anything else at the moment. It's just completely just taken over everything I can think about.
I completely understand, sir, and I know it's easy for me to sit here on the other side of the line and just give you these instructions, but trust me, they've worked for me in the past, they've worked for my patients, and I'm really hoping they'll work for you as well.
Well, let's hope so.
Do you have any other questions at all? Is there anything else I can help you with?
No, just that. I just hope you're right.
So just to summarize, you've had this pain left side of your mouth on the bottom,
Right
and
side.
sorry, excuse me, right side. It's hard to picture when you're not there in person, but I guess with this virus, it's pretty tough. This is the situation we're in. But yeah, sorry, the right side of your mouth on the bottom. You're having some trouble swallowing because it's painful. No breathing difficulties, no swelling, no fever, no temperature. Um,
Yeah.
and from what you're telling me in the history you've given me, like I said, I think it's a case of pericoronitis. So just remember paracetamol, then ibuprofen 4 times a day. Warm salt water mouth rinses and try and brush the area to keep it clean. See how that goes for the next 2 to 3 days. Any problems, any swelling, breathing difficulty, fever, temperature, give us a call back, and if necessary, we'll get you seen by someone.
Right. Okay. Well, you can be sure I will call back if there's any other problems.
Oh, sure. And any other problems, give us a call back. We'll be more than happy to help.
Yeah, I will do. Don't worry about that.
Okay, perfect. All right, so anything else I can help you with at all? Any
No, that's
questions?
it. No, nothing else.
All right, okay, so we'll try and have a good evening if you can, and take care. And like I said, any problems, please do give us a call back.
Yeah. All right.
All right, great. So thanks very much. You have a good night.
Bye.
All right, thank you. Bye.